Welcome to Flash News.
COVID-19 linked to impaired heart function. Study finds COVID-19 is associated with impaired function of the right side of the heart, new research on intensive care patients has found. Led by experts from NHS Golden Jubilee, the COVID-RV study was carried out in 10 intensive care units in Scotland. It assessed the impact the virus had on 121 critically ill patients who required treatment on ventilators. About 1 in 3 patients showed abnormalities in the side of the heart that pumps blood to the lungs. Nearly half, 47%, of ventilated patients in the study died because of COVID-19, a figure comparable to national and international death rates. The research, conducted at the height of the pandemic from September 2020 to March 2021 before the full impact of the vaccine program kicked in, sought to help improve future care and outcomes for those most at risk from the virus. Dr. Philip McCall, lead author of the study and consultant in cardiothoracic anesthesia and intensive care at NHS Golden Jubilee, said a combination of factors create the perfect storm for COVID-19 to damage the right side of your heart, which can ultimately cause death. If you're pumping blood to the lungs and the lungs become very sick, you have an additional problem because the lungs are not willing to receive blood, he explained. This is a very difficult condition to spot, unless you are specifically looking for it. That is why the results of this study are so important. We now know that COVID-19 is a problem associated with not just ventilation, but can affect the heart. Invaluable knowledge. Traditionally, such studies would take at least a year just to plan, but because of the pandemic the research was carried out in an accelerated timeframe and completed in a little under 7 months. Experts at the Golden Jubilee National Hospital in Clydebank said the findings could play a vital role in not only saving the lives of COVID-19 patients, but for the care of potentially fatal heart and lung issues generally. Dr. Ben Shelley, chief investigator of the study and an intensive care consultant at the hospital, said the study, published in the journal Anesthesia, revealed there was no doubt COVID-19 affects the heart and had a major impact on outcomes for the patient. He said new care plans and treatments could be put in place to help combat the effects, such as ultrasound scans being used differently to focus on areas at risk. If we are able to see these warning signs early enough, clinicians can explore the causes of any complications and start new treatments as soon as possible, potentially improving outcomes for the sickest patients with COVID-19, he added. This kind of knowledge is invaluable, not only in combating any future waves of COVID-19, but in planning for future pandemics to allow people to be treated more effectively. Heart inflammation. Meanwhile, a different study led by the University of Glasgow found 1 in 8 people admitted to hospital with COVID-19 between May 2020 and March 2021 were later diagnosed with myocarditis, or heart inflammation. The research, carried out in collaboration with NHS Greater Glasgow and Clyde and published in Nature Medicine, followed 159 patients for 1 year after they were hospitalized with the virus. Until now it had been thought that previous underlying health conditions may have been linked to the severity of post-COVID long-term effects. But Professor Colin Berry, a cardiology professor at the University of Glasgow, said the study suggested the severity of the infection itself was most closely correlated to the nature of a patient's long COVID symptoms, rather than pre-existing health problems. We found that previously healthy patients, without any underlying health conditions, were suffering with severe health outcomes, including myocarditis, post-hospitalization, he said. U.S. in process of releasing monkeypox vaccine from national stockpile for high-risk people, CDC says, CNN. The United States is responding to a request for the release of monkeypox vaccine from the nation's strategic national stockpile as a global outbreak of cases is under investigation. There is 1 confirmed case of monkeypox and 4 suspected cases in the United States, the U.S. Centers for Disease Control and Prevention said Monday. I can report that there has been a request for release of the Jynneos vaccine from the national stockpile for some of the high-risk contacts of some of the early patients, so that is actively happening right now. Dr. Jennifer McQuiston, Deputy Director of the Division of High-Consequence Pathogens and Pathology within the CDC's National Center for Emerging and Zoonotic Infectious Diseases, said Monday. McQuiston said the United States has a good stock of vaccine because it has been preparing for the possibility of needing to use doses for smallpox. And the United States, the 2-dose Jynneos vaccine is licensed to prevent smallpox and specifically to prevent monkeypox. Right now, we have over 1,000 doses of that available, and we expect that level to ramp up very quickly in the coming weeks as the company provides more doses to us, McQuiston said. There is another smallpox vaccine licensed in the United States, ACAM2000, that could be used to prevent monkeypox, she said, and the country has more than 100 million doses. ACAM2000 is an older generation smallpox vaccine that has some potential significant side effects with it. So a decision to use that widely would have to have some serious discussion behind it, McQuiston said. Overall, we are hoping to maximize vaccine distribution to those that we know would benefit from it, she said. Those are people who've had contact with the known monkeypox patients, healthcare workers, very close personal contact, and those in particular who might be at high risk for severe disease. The confirmed U.S. monkeypox case is in a man in Massachusetts, and the 4 cases of orthopox are in men in New York, Florida, and Utah, the CDC says. Orthopox refers to pox viruses in general. McQuiston said healthcare providers should assume that these orthopox cases are monkeypox. It is likely that there are going to be additional cases reported in the United States, she said. McQuiston said the CDC expects to receive samples from the 4 suspected cases, today or tomorrow, for further analysis. Labs within the CDC's laboratory response network can test for an orthopox virus, and then confirmation of monkeypox specifically is done at the agency through PCR tests, which take a couple of hours to run, she said. From the time that CDC gets a specimen, we could do our monkeypox confirmatory PCR tests likely the same day. We've been seeing turnaround of a couple of days really, from the time a suspect patient might come to a doctor's attention to they can get that initial state LRN laboratory results, McQuiston said. CDC sequencing of the sample from the confirmed case in Massachusetts went really quickly, and within 48 hours, researchers were able to see that it closely matched that of a case in Portugal. This process previously took up to 2 weeks, but we were able to get it posted within 2 days because we feel like this kind of public sharing of early sequence data is going to be important for all countries to do so that we can all better understand how the virus is spreading across the globe, McQuiston said. Monkeypox is not spread through sex itself but can be spread through contact during sex, said Dr. John Brooks, the CDC's chief medical officer of HIV prevention. Monkeypox is not a sexually transmitted infection in the typical sense, but it can be transmitted during sexual and intimate contact, as well as with personal contact and shared bedding and clothing, Brooks said Monday. Anyone can get or spread monkeypox, but a notable fraction of cases in the latest global outbreak are happening among gay and bisexual men. Some groups may have a greater chance of exposure right now, but by no means is the current risk of exposure to monkeypox exclusively to the gay and bisexual community in the U.S., Brooks said. Anyone can develop and spread monkeypox infection, but many of those affected in the current global outbreak identified as gay and bisexual men. Brooks said the CDC decided to hold a news conference about the outbreak now because LGBTQ Pride Month usually kicks off around the Memorial Day weekend, and officials wanted to make sure the community was aware of the situation. He also urged doctors to be on the lookout for the disease, because it can look like other types of STDs. He said the rash is showing up in different parts of the body than we typically expect to see it. In some cases, it has produced anal or genital lesions that look like other diseases like herpes, chickenpox, or syphilis. So anyone with a rash or lesion around or involving their genitals, their anus, or any other place that they have not seen it before, get fully evaluated, both for that rash but particularly for sexually transmitted infection and other illnesses that can cause rash, he said. What we're trying to do by bringing attention to the fact that some of these cases have had a genital and perianal presentation is just to remind people that people may come in for an evaluation of what they think is an STD, but we'd like the provider to think could it be monkeypox as well. If the circumstances fit the story. Anyone can get monkeypox, but CDC warns LGBTQ community about greater chance of exposure now, CNN, anyone can get or spread monkeypox, but a notable fraction of cases in the latest global outbreak are happening among gay and bisexual men, the U.S. Centers for Disease Control and Prevention said Monday. Some groups may have a greater chance of exposure right now, but by no means is the current risk of exposure to monkeypox exclusively to the gay and bisexual community in the U.S., said Dr. John Brooks, Chief Medical Officer for the CDC's Division of HIV/AIDS Prevention. Anyone can develop and spread monkeypox infection, but many of those affected in the current global outbreak identified as gay and bisexual men. There is one confirmed case of monkeypox and 4 suspected cases in the United States, the CDC said Monday. The confirmed case is in a man in Massachusetts, and the 4 cases of orthopox are in men in New York, Florida, and Utah. Orthopox refers to pox viruses in general. It is likely that there are going to be additional cases reported in the United States, said Dr. Jennifer McQuiston, a veterinarian and deputy director of the CDC's Division of High-Consequence Pathogens and Pathology. Brooks said the CDC decided to hold a news conference about the outbreak now because LGBTQ Pride Month usually kicks off around the Memorial Day weekend, and officials wanted to make sure the community was aware of the situation. He also urged doctors to be on the lookout for the disease, because it can look like other types of STDs. In some cases, during the early stages of illness, the rash has been mostly in the genital and perianal area, Brooks said. In some cases, it has produced anal or genital lesions that look like other diseases like herpes or chickenpox or syphilis. What we're trying to do by bringing attention to the fact that some of these cases have had a genital and perianal presentation is just to remind people that people may come in for an evaluation of what they think is an STD, but we'd like the provider to think, could it be monkeypox as well, if the circumstances fit the story, Brooks added. Monkeypox is an extremely rare viral disease that is similar to smallpox, but it is considered clinically less severe, according to the World Health Organization. Cases usually happen in West and Central Africa. But several people have been diagnosed with monkeypox recently in areas that don't typically see the disease, including in Canada, Portugal, Spain, the United Kingdom and the US. Monkeypox is not a sexually transmitted disease, but it can spread through intimate contact during sex when someone has an active rash. It also can spread through large respiratory droplets, but because large droplets don't travel far in the air, the contact has to be prolonged for this to happen. Monkeypox can spread through direct contact with bodily fluids or through contact with contaminated clothes or bedsheets, according to the CDC. Anyone can spread monkeypox from contact with body fluid or monkeypox sores or respiratory droplets when close to someone, Brooks said. The virus typically incubates for 7 to 14 days before symptoms appear, according to the CDC. Initial symptoms include swollen lymph nodes, headache, fever, muscle aches and fatigue. The disease then progresses into a rash and lesions that blister and scab over. This can happen all over the body. The illness usually lasts 2 to 4 weeks. A person can be contagious from 1 day before the rash appears until up to 21 days after symptoms began. Once the scabs fall off, the person is no longer contagious, the CDC says. The risk to the general public from this outbreak is low, according to the CDC. I don't think that there's a great risk to the general community from monkeypox right now in the United States. I think that we need to pay close attention to the communities in which this might be circulating so that we can communicate effectively with them and help bring this outbreak under control, McQuiston said. Monkeypox doesn't seem to be spreading so quickly that parties or events needed to be cancelled to stop the spread. This is not COVID, McQuiston said. Respiratory spread is not the predominant worry. It is contact, and intimate contact, in the current outbreak setting and population. And that's really what we want to emphasize. It's also important that this outbreak not cause stigma toward the LGBTQ community, according to the Joint United Nations Program on HIV/AIDS. It warned that some reporting and commentary on monkeypox has used language and imagery that reinforce stereotypes and exacerbate stigma. Experience shows that stigmatizing rhetoric can quickly disable evidence-based response by stoking cycles of fear, driving people away from health services, impeding efforts to identify cases, and encouraging ineffective, punitive measures. We appreciate the LGBT community for having led the way on raising awareness, and we reiterate that this disease can affect anyone, UNAIDS Deputy Executive Director Matthew Cavanaugh said in a statement Monday. The WHO also cautioned people not to use the disease as a way to negatively label any particular community. There's a lot of stigma and discrimination that surrounds many diseases, and I think the key thing we need to look out for is, as WHO, to work with our partners in communities and elsewhere to make sure that the messaging is correct. So while we are seeing some cases among men who have sex with men, this is not a gay disease, WHO advisor Andy Seal said Monday. There is no proven, safe treatment for monkeypox, but a vaccine made by a Danish company called Bavarian Nordic has been approved by the U.S. Food and Drug Administration. The U.S. has signed a new contract with the company and placed a $119 million order, with the option to buy $180 million more if necessary. Because the monkeypox virus is closely related to the smallpox virus, the smallpox vaccine can protect against monkeypox, according to the CDC. The strategic national stockpile has enough smallpox vaccine to protect everyone in the U.S., according to the CDC. The U.S. is in the process of responding to a request for the release of the Bavarian Nordic Jynneos monkeypox vaccine from the stockpile. The CDC recommends that anyone with a new or unexplained rash get it checked by a medical professional. People who are infected should stay isolated at home, away from people and pets, should wear a surgical mask and should cover their lesions as much as possible until they have healed. They should avoid close contact with children, people who are pregnant and those who have weakened immune systems because these groups are at higher risk of complications if they catch the virus. Scientists have unlocked the vitamin D potential of tomatoes, study says. CNN. Fish and dairy products are the best dietary sources of vitamin D, which can make it a struggle for those on a plant-based diet to get enough of the essential micronutrient. Vitamin D helps protect our bones and keep muscles and teeth healthy. Now, a team of researchers have come up with a potential new and vegan source of vitamin D, tomatoes gene-edited using CRISPR-Cas9 technology to contain a precursor to vitamin D. If the process is adopted commercially by farmers and producers, these tomatoes could help address vitamin D insufficiency, which the study said affects 1 billion people globally. This exciting discovery not only improves human health but contributes to the environmental benefits associated with more plant-based diets, often linked with a challenge in securing some key vitamins and minerals widely found and bioavailable in animal products. Guy Poppy, a professor of ecology at the University of Southampton, told the Science Media Centre in London. He wasn't involved in the research. Vitamin D supplements are widely available in many countries, but co-author Kathy Martin, a professor at the John Innes Centre in Norwich, England, said that eating a tomato was so much better than taking a pill. I think that having a dietary source of vitamin D in the form of a plant also means that you can get added benefit from eating tomatoes. We don't eat enough fruit and veg anyway. A tomato is a good source of vitamin C as well, she said at a news briefing. The study published Monday in the scientific journal Nature Plants. Sunshine vitamin. The main source of vitamin D for most people is dietary, but our body also makes the micronutrient when skin is exposed to UVB light. That's why it's sometimes called the sunshine vitamin. The scientists harnessed a similar process in tomato plants. The compound in the skin that can make vitamin D is known as 7-DHC, or provitamin D3, and it's also found in tomato plant leaves and unripe green fruit. The researchers blocked a gene in tomato plants that normally converts provitamin D3 into cholesterol, which enabled provitamin D3 to accumulate in the ripe tomato fruit. To convert the provitamin D3 into vitamin D3 that helps our bodies, the tomatoes were treated with UVB light. The study found that provitamin D3 in one tomato once converted to vitamin D3 would be equivalent to the amount of vitamin D3 contained in 2 medium-size eggs or 28 grams, 1 ounce, of tuna. A trial in the United Kingdom is assessing whether growing the tomato plants outdoors, where they would be exposed to natural sunlight, would automatically result in the conversion of 7-DHC to vitamin D3. The first fruits are expected to ripen by the end of June, Martin said. The tomatoes could also be sun-dried once picked, removing the need for treatment with UVB light, she added. The UK Parliament passed new legislation earlier this year that is designed to facilitate trials of gene-edited crops. Other vegetables. The gene-blocking technique, which the researchers are making freely available with the publication of the paper, could also be applied to other species of solanaceous plants such as bell peppers, chilies, eggplants and potatoes, Martin said. Mushrooms can also be a source of vitamin D when treated with UVB light or wild-grown, according to the researchers. However, these plants produced vitamin D2, which the paper said was substantially less bioeffective than vitamin D3, which comes from meat and dairy. Also, vitamin D3 supplements typically aren't vegan, said Susan Langham New, a professor of nutritional sciences at the University of Surrey in the UK. She wasn't involved in the study. Lanolin, which is the main source for D3, is extracted from sheep's wool. The sheep is still alive, so it is okay for vegetarians. But it is not for vegans, and that's one of the things that makes this study very extraordinary, is that you have a D3 source from a plant, she said at the briefing. The leaves of the gene-edited tomato plants also contained a substantial amount of provitamin D, the researchers said. They were looking at ways this waste material could be turned into vegan vitamin D supplements. The study team hoped this could act as incentive for producers to plant and produce the biofortified tomatoes. The gene-edited tomatoes looked indistinguishable from and tasted the same as regular tomatoes, said co-author Ji Li, a postdoctoral researcher at the John Innes Center, and gene editing didn't affect the plant's growth, development, or yield. The scientists who devised the CRISPR-Cas9 gene editing technology won the Nobel Prize in 2020. The tool is having a major impact on biomedical research, clinical medicine, agriculture, and farming. Like a pair of precision scissors, it can target predetermined sites in genetic material, knocking out a particular gene or inserting new genetic material. 3-dose COVID-19 vaccine produces strong immune response in children ages 6 months to 5 years, Pfizer and BioNTech say, CNN. 3 child-sized doses of the Pfizer/BioNTech COVID-19 vaccine appeared to be safe and showed a strong immune response in children ages 6 months to 5 years, the companies said Monday. The vaccine makers said they will finish submitting the trial data to the U.S. Food and Drug Administration this week. The Phase 2 thirds trial included 1,678 children who received a third vaccine dose during the period when the Omicron coronavirus variant dominated. Antibody levels tested 1 month after the third dose showed that the vaccine produced a similar immune response as 2 doses in 16 to 25-year-olds, the companies said. The data has not been peer-reviewed or published in a professional journal. Mid-trial results found vaccine efficacy of 80.3% against symptomatic COVID-19 in this young age group. The companies identified 10 symptomatic cases at least 7 days after the third dose. However, the efficacy rate won't be finalized until at least 21 symptomatic cases are found in the vaccine group and compared with the number of symptomatic cases in the placebo group. The companies said that 3 child-sized doses for this age group were well tolerated and that no new safety signals were identified. These top-line safety, immunogenicity, and efficacy data are encouraging, and we look forward to soon completing our submissions to regulators globally with the hope of making this vaccine available to younger children as quickly as possible, subject to regulatory authorization, Pfizer chairman and CEO Albert Bourla said in a statement. The vaccine doses for these children are smaller than those used in older age groups. People 12 and older receive 2 doses of a 30 microgram vaccine, and children ages 5 to 12 receive 2 doses of a 10 microgram vaccine. Both of those age groups are eligible for booster doses. For children 6 months to 5 years, the Pfizer/BioNTech vaccine is 3 microgram doses. The initial 2 doses were given 3 weeks apart, and the third dose was given at least 2 months after their second dose. Dr. William Schaffner, a professor in the Division of Infectious Diseases at Vanderbilt University School of Medicine, said Monday that vaccine scientists have been careful to adjust the dose for younger children to get a good effect with a minimum of side effects. We're thinking of this as a 3-dose vaccine, and the preliminary data acquired during the Omicron era say it's actually 80% effective, Schaffner told CNN's Brianna Keilar. We will want to look at that very carefully, but so far, that's good news. Children younger than 5 are the only age group not eligible for vaccination against COVID-19. The vaccine for this age group was delayed when results of a 2-dose series of the Pfizer/BioNTech vaccine didn't provide the expected level of protection. The companies said they would amend the trial to add a third dose. In February, the U.S. Food and Drug Administration asked the companies to submit a request for emergency use authorization based on the 2-dose data, but then postponed a meeting of the agency's Vaccine Advisory Board so the third dose data could be considered. The FDA said Monday that it will convene its Vaccines and Related Biological Products Advisory Committee on June 14 to discuss Moderna's COVID-19 vaccine EUA request for people ages 6 years through 17. On June 15, the committee will discuss Moderna and Pfizer's EUA requests for vaccines for younger children. Moderna submitted its vaccine data for children 6 months through 5 years of age to the FDA in late April. Moderna's submission is based on two 25 microgram doses given 28 days apart. What is monkeypox and its signs and symptoms? CNN, an extremely rare disease called monkeypox, a cousin of smallpox, has again made its way to the United States. A case of monkeypox was reported Wednesday in a patient hospitalized in Massachusetts who had recently traveled to Canada in private transportation. In 2021, 2 people traveling from Nigeria to the U.S. were diagnosed with the disease, according to the Centers for Disease Control and Prevention. Monkeypox is mostly found in West and Central Africa, but additional cases have been seen in Europe, including the United Kingdom, and other parts of the world in recent years. Those cases are typically linked to international travel or imported animals infected with the pox, the CDC said. On Thursday, Spain confirmed 7 cases of monkeypox in Madrid and are investigating another 22. Italy confirmed its first case, and Canadian public health officials announced they are investigating 17 suspected cases of monkeypox in Montreal. Several cases of monkeypox in the UK among people who have no known travel or contact with others with the virus have health officials there and at the CDC concerned, but there is no cause for alarm, U.S. Surgeon General Dr. Vivek Murthy said Thursday on CNN's New Day. At this time, we don't want people to worry, Murthy said. These numbers are still small, we want them to be aware of the symptoms, and if they have any concerns to reach out to their doctor. What are the initial symptoms of monkeypox? There is an incubation period of some 7 to 14 days, the CDC said. Initial symptoms are typically flu-like, such as fever, chills, exhaustion, headache and muscle weakness, followed by swelling in the lymph nodes, which help the body fight infection and disease. A feature that distinguishes infection with monkeypox from that of smallpox is the development of swollen lymph nodes, the CDC said. Next comes a widespread rash on the face and body, including inside the mouth and on the palms of the hands and soles of the feet. The painful, raised poxes are pearly and fluid-filled, often surrounded by red circles. The lesions finally scab over and resolve over a period of 2 to 3 weeks, the CDC said. Treatment is generally supportive as there are no specific drugs available. However, a vaccine is available that can be given to prevent the development of disease, Jimmy Whitworth, Professor of International Public Health at the London School of Hygiene and Tropical Medicine, said in a statement. How is monkeypox spread? Close contact with an infected individual is required for the spread of the monkeypox virus, experts say. Infection can develop after exposure to broken skin, mucous membranes, respiratory droplets, infected body fluids or even contact with contaminated linen, Neil Mabott, Personal Chair in Immunopathology at the Veterinary School of the University of Edinburgh in Scotland, said in a statement. When the lesions have healed, the scabs, which might carry infectious virus, can be shed as dust, which could be inhaled, said Dr. Michael Skinner, who is on the Faculty of Medicine in the Department of Infectious Disease at Imperial College London, in a statement. Transmission between people occurs primarily through large respiratory droplets, and because such droplets typically travel only a few feet, prolonged face-to-face contact is required, the CDC said. Monkeypox can be a serious infection, with mortality rates from this type of monkeypox virus having been around 1% in other outbreaks. These are often in lower-income settings with limited access to health care, said Michael Head, Senior Research Fellow in Global Health at the University of Southampton in the UK. However, in the developed world, it would be very unusual to see anything more than a handful of cases in any outbreak, and we won't be seeing COVID-style levels of transmission, Head said in a statement. Common household disinfectants can kill the monkeypox virus, according to the CDC. Where did monkeypox originate? Monkeypox got its name in 1958 when 2 outbreaks of a pox-like disease occurred in colonies of monkeys kept for research, the CDC said. However, the main disease carrier of monkeypox is still unknown, although African rodents are suspected to play a part in transmission, the agency said. The first known case of monkeypox in people was recorded in 1970 in the Democratic Republic of Congo during a period of intensified effort to eliminate smallpox, the CDC said. After 40 years with no reported cases, monkeypox re-emerged in Nigeria in 2017, the CDC said. Since then, there have been more than 450 reported cases in Nigeria and at least 8 known exported cases internationally, the agency said. An outbreak occurred in the U.S. in 2003 after 47 people in 6 states Illinois, Indiana, Kansas, Missouri, Ohio, and Wisconsin became ill due to contact with their pet prairie dogs, the CDC said. The pets were infected after being housed near imported small mammals from Ghana, the CDC said. This was the first time that human monkeypox was reported outside of Africa. Kids can show anxiety symptoms early on. Here's how to spot them. CNN. Your child doesn't want to go to the playground to play with other kids. Or she doesn't want to attend a friend's birthday party or the class pool party. How do you know whether she's just having a bad day or if it's a sign of ongoing anxiety she might be experiencing? Anxiety disorders are marked by persistent and excessive worries. While someone with generalized anxiety might worry about various everyday things, someone with social anxiety typically has intense or persisting fears or worries about being judged negatively by other people, said Rachel Bussman, a White Plains, New York-based clinical psychologist and cognitive and behavioral consultant who specializes in anxiety. You're worried about saying or doing something that's going to make you look dumb or incompetent. 1/5 of children worldwide have anxiety symptoms that are clinically elevated, or worse than what's considered normal, according to a 2021 study. In the United States, 9.4% of children ages 3 to 17, about 5.8 million, had diagnosed anxiety between 2016 and 2019, according to the U.S. Centers for Disease Control and Prevention. Sign up for CNN's Stress, But Less newsletter. Our 6-part mindfulness guide will inform and inspire you to reduce stress while learning how to harness it. Anxiety symptoms can be difficult to spot, but the sooner parents notice signs, the earlier mental health professionals can help parents and kids understand what's happening, said Dr. Rebecca Bong, a professor of general pediatrics and adolescent medicine at the University of North Carolina at Chapel Hill. Children with anxiety might begin to avoid anxiety-inducing situations. This behavior can facilitate a cycle that makes their fears bigger and bigger, Baum added. But, the earlier we have tools, the earlier we can set kids on a path that encourages them to be resilient and helps them face the things they're fearful of, Bussman said. Read on to learn about early physical, behavioral, and emotional signs of general or social anxiety, and how to help your child. General anxiety. Common signs of general anxiety in children according to the United Kingdom's National Health Service, Michigan State University, Bong and Bussman include difficulty concentrating, trouble sleeping, bedwetting or bad dreams, not eating properly, clinginess, lack of confidence to try new things or inability to deal with simple, everyday problems, avoidance of everyday activities, such as seeing friends or going out in public or to school, inability to talk in some social situations, reassurance seeking, repeated questions to reconfirm worries, such as exactly when and where you're going to pick them up from school, or if the weather's really going to be nice enough for a play date, physical symptoms such as using the toilet often, tearfulness, headaches, dizziness, lightheadedness, sweatiness, stomach aches, nausea, cramps, vomiting, fidgeting, or body aches, especially if they usually occur before an educational or social obligation. Tantrums, irritability, or defiance could be misunderstood as disrespectful behavioral problems, but anxiety could be the underlying cause, Bussman said. Refusal to do homework could be because they are anxious about making mistakes. Children don't necessarily have the tools to say, "This is really causing me distress," Bussman said. So, they act out. Social anxiety. Many symptoms of social anxiety are like those of general anxiety but come up in social settings, Bussman said. Children struggling with social anxiety might show these signs, according to Children's National Hospital in Washington, D.C., the National Social Anxiety Center and the Mayo Clinic. Avoiding or refusing to go to school, refusing to speak in social settings or speaking in a soft or low tone, poor social skills, such as fearing strangers or not making eye contact, fearing or having difficulty with using public restrooms, speaking on the phone, giving public performances, eating in front of others, being called on in class, or being separated from parents. Physical symptoms including fast heartbeat, trembling, trouble catching their breath, feeling their mind has gone blank and muscle tension. Having conversations that count. Getting to the bottom of what's anxiety-inducing for your kid is important, but it must be done compassionately without grilling, which could make her feel defensive or put on the spot, and lead to her not wanting to talk with you at all. Curious and non-leading questions are good, busman recommended. Open prompts such as "I noticed you seemed hesitant going into that activity. What's up?" might work better than "Were you scared of going in, or did you not like those people?" Ask your child how a certain event went, what she liked about it and what was hard. Very young children might be unable to identify specific fears, such as saying something stupid or other kids seeing their anxiety, according to Anxiety Canada. So some kids might verbalize those concerns in ways that make sense to them, such as, "I didn't want people to look at my drawing," or, "My voice really sounds funny," busman said. If your child's honest about what's making them anxious, avoid invalidating the experience by saying, "That's nothing to be scared about," or, "Don't be a baby." Also avoid affirming fears. Saying, "That does sound so scary, I'm so sorry you had to do that," can make the child feel more fragile, busman said. A good balance is saying, "That does sound hard," and then a statement that acknowledges your child's capability to face the challenge and that you know you two can figure it out together, busman added. If your child's anxious about starting soccer practice and not kicking the ball, use some form of the above statement and reassure her that she'll improve with practice, but don't overdo it by saying she'll kick the winning goal, which might not happen. We sometimes get nervous about somehow having our children experience less than perfect moments, busman said, but teaching that imperfection is okay is crucial. Your child might miss the ball sometimes, and being liked by everyone isn't realistic. Navigating stress is an important part of childhood, Baum said. Parents and caregivers can model this by talking about times when they've been anxious about something but tried to tackle it, even if it didn't turn out exactly how they had hoped. If you're worried that talking to your child's teachers could cause stigma or a problem where there might not be one, know that consulting them is worthwhile since they observe your child for many hours in different environments daily and therefore are often really good sources of information, busman said. Sometimes how kids are at home isn't how they are at school and vice versa. A teacher can tell you how your child is interacting with peers and whether she's still sad or anxious after you drop her off at school. When worries persist and interfere with a child's ability to do the things they need to do to be kids, busman said, that's a good time to seek some more support. The best treatment for anxiety disorders is cognitive behavioral therapy that involves some level of exposure therapy, which can help kids get comfortable doing the things they are scared of, busman said. Your child's primary care provider can help distinguish between what's typical for the child's age/developmental level and what might be cause for concern, Baum said. Even if symptoms are typical for the child's age, families still may appreciate help managing them successfully. Baum added, getting right up to and even just past the child's comfort zone is the spot where growth happens. Monkeypox virus outbreaks are containable. Monkeypox can be contained in countries outside of Africa where the virus is not usually detected, the World Health Organization, WHO, says. More than 100 cases of the virus, which causes a rash and a fever, have been confirmed in Europe, the Americas, and Australia. That number is expected to rise still, but experts say the overall risk to the broader population is very low. The virus is most common in remote parts of Central and West Africa. This is a containable situation, the WHO's emerging disease lead Maria van Kerkhove said at a news conference on Monday. We want to stop human-to-human transmission. We can do this in the non-endemic countries, she added, referring to recent cases in Europe and North America. What is monkeypox and how do you catch it? Monkeypox, time to worry or one to ignore. The virus has now been detected in 16 countries outside Africa. Despite being the largest outbreak outside of Africa in 50 years, monkeypox does not spread easily between people and experts say the threat is not comparable to the coronavirus pandemic. Transmission is really happening from skin-to-skin contact. Most of the people who have been identified have more of a mild disease, Ms. van Kerkhove said. Another WHO official added that there was no evidence the monkeypox virus had mutated, following earlier speculation over the cause of the current outbreak. Viruses in this group tend not to mutate and they tend to be fairly stable, said Rosamund Lewis, who heads the WHO's smallpox secretariat. Meanwhile, a top EU health official has warned that some groups of people may be more at risk than others. For the broader population, the likelihood of spread is very low, said Dr. Andrea Ammon of the European Centre for Disease Prevention and Control. However, the likelihood of further spread of the virus through close contact, for example during sexual activities amongst persons with multiple sexual partners, is considered to be high. Monkeypox has not previously been described as a sexually transmitted infection, but it can be passed on by direct contact during sex. Dr. Ammon suggested that countries should review the availability of the smallpox vaccine, which is also effective against monkeypox. In the UK, which has now recorded 57 cases, authorities are advising anyone who has had close contact with a confirmed case to isolate for 21 days. A person is considered at high risk of having caught the infection if they have had household or sexual contact with someone with monkeypox, or have changed the bedding of an infected person without wearing personal protective equipment, PPE. Symptoms, which include a high temperature, aches, and a rash of raised spots that later turn into blisters, are typically mild and for most people clear up within 2 to 4 weeks. Scotland's first monkeypox patient in hospital. Scotland's first monkeypox patient is being treated in hospital, Public Health Scotland has confirmed. It is understood that the person, who has not been named, is not seriously ill but is being monitored as a precaution in a specialist infectious diseases unit. Their close contacts are being offered a smallpox vaccine. There have now been 57 confirmed cases of the viral infection in the UK. Public Health Scotland said the case was not linked to international travel and the affected individual was exposed to the virus in the UK. Details of the Scottish case were released as new guidance from the UK Health Agency. Security urged anyone at the highest risk of having caught monkeypox to isolate for 21 days. What are the symptoms? The rash changes and goes through different stages, and can look like chicken pox or syphilis, before finally forming a scab, which later falls off. Initial symptoms include fever, headaches, swellings, back pain and aching muscles. Once the fever breaks, a rash can develop, often beginning on the face, then spreading to other parts of the body, most commonly the palms of the hands and soles of the feet. The rash, which can be extremely itchy or painful, changes and goes through different stages before finally forming a scab, which later falls off. The lesions can cause scarring. The infection usually clears up on its own and lasts between 14 and 21 days. 2px presentational gray line. The disease, first found in monkeys, does not tend to spread easily between people but can be transmitted through close physical contact. That includes touching clothing, bedding, or towels used by someone with monkeypox. Rash, touching monkeypox skin, blisters or scabs. The coughs or sneezes of a person with the monkeypox rash. Dr. Nick Finn, Director of Public Health Science and Medical Director at Public Health Scotland, said the overall risk to the general public is low. We have well-established and robust infection control procedures for dealing with such cases of infectious disease and these will be strictly followed, he said. We are working with NHS boards and wider partners in Scotland and the UK to investigate the source of this infection. Close contacts of the case are being identified and provided with health information and advice. This may include the offer of vaccination. Smallpox vaccine. There is no specific vaccine for monkeypox, but a smallpox jab offers 85% protection as the two viruses are quite similar. Dr. Finn said a more than sufficient number of vaccine doses had been ordered for the first Scottish case, adding that 10 to 20 contacts would be expected for each monkeypox patient. Public Health Scotland said the smallpox vaccines were being stored in Edinburgh and Glasgow but they were looking for locations suitable for a larger quantity of doses. The vaccine is stored at -80C to -20C, but can be kept in a fridge for up to 8 weeks after thawing. Across the UK, 1,000 doses of the Mvanex vaccine have already been issued or are in the process of being issued, leaving more than 3,500 doses in the UK. Dr. Finn said the vaccines were not compulsory for contacts and there would not be a mass vaccination program in a scenario like COVID. He added, anyone with an unusual blister-like rash or small number of blister-like sores on any part of their body, including their genital area, should avoid close contact with others and seek medical advice if they have any concerns. A large proportion of the UK cases have been identified in gay and bisexual men, and men who have sex with other men. Andy Seal, an advisor to the WHO, said, while we're seeing some cases in men, this is not a gay disease as some people and social media have labeled it. It seems clear it's linked to close contact, whether through social contact or possibly sexual contact, he added in a social media session that was set up to answer questions from the public. An expert in infectious diseases said superspreader events were likely to be behind the recent rise in global cases. Sir Jeremy Farrer, director of charitable health foundation Wellcome Trust, told BBC Radio 4's Today programme the Trust had never seen anything like this before, with such a number of cases in so many countries. He said, "The virus may have changed, but I think that's unlikely. More likely is, I think, that the niche that this virus now finds itself in has allowed for some super spreader events, and those individuals involved in that have then traveled to other parts of the world and taken the infection with them." He said the UXA deserves great credit for its textbook example response to the outbreak.